what I tried to do with this presentation is just kind of tell you a little bit about why I think you should have your wisdom teeth out, what happens if you don't have them out, and a lot of humor mixed in. I want to keep it light. I want to keep everybody awake, right? And try to have some fun with a topic that's pretty scary. As we talk to folks that have already had it done. So basically, it just titled the presentation. Why in the heck do they need to come out? Why does everybody have their wisdom teeth out or being told they should? And then if you need them out, what to expect. So we're going to kind of go through some of this. So it's why right there. It's why. All right, so some of the things we're going to talk about, of course, the first question is why do I need them out? And do I really need them out? So we'll talk about some of the reasons to do that, some of the reasons maybe not to do that. What to expect when you come to any oral surgeon's office, when you come for your consultation. Also, maybe put a little plug for my office. What you can expect that I think makes us, kind of different and kind of special. Also, what to expect on the day of surgery, and then probably most importantly, excuse me, what everybody wants to know is, what happens after the surgery is done, and how long am I going to be laid up, and how much pain am I going to have, and all of that. So. What happens if we leave these impacted wisdom? Everybody in the world has heard of an impacted wisdom tooth. All you really need to know is that they cause an awful lot of problems. We're going to talk about what some of those problems are. But, what happens if we leave these guys in there, and what kind of problems are we going to have from that? So here's what happened. This is Chris Rock before, Chris Rock after. I didn't do surgery, but that's what it looks like. And excuse me, this one's for the ladies. I put one in for the ladies too, So it's going to make you look a lot better. So the biggest problem with wisdom teeth, the thing that happens most often, and the reason that these teeth cause so much grief, is infection. Infections are extremely common around wisdom teeth. You can get infections from little tags of tissue laying over the tooth. It can be something really, really tiny like this. Just a little bit of plaque, which is bacteria, slides up underneath there and causes infection. So you can have a tooth that's mostly exposed or even fully exposed and have problems with it. Or it could be something much bigger, a tooth that's partially exposed and the gum tissue is all swollen and red and irritated. To a full-fledged, just full-out infection where there's possibly fever and all this nastiness. So this is the main reason that we recommend getting your wisdom teeth out. But there are also a number of other things. So dental caries. Dental caries is just a fancy term for a cavity. You can get cavities in these teeth, whether they're exposed like this one or even if they're down under the gum. A lot of times it will happen. You can get damage to not only the wisdom tooth, but the neighboring tooth that you do kind of want to keep and hold on to. So, just an X-ray of impacted wisdom teeth, and of course you can see a lot of decay on the side of these neighbors. When this sort of thing happens, this is what I like to call a 2-for-1. This is, you wind up losing both of these things, and we want to prevent that from happening. So this is why you want to get these guys out. That happens because of this little crease here. Black bacteria gets in there, causes decay, and can do a lot of damage to all the teeth. It's just a CAT scan image of pretty much the same thing, an impacted wisdom tooth down in the bone. These are the roots of the neighbor, and it doesn't show up real well over here, but a little decay on the side of the root. This area is this right down here. So, it can do a lot of damage, and you can wind up losing your roots. So don't do this, that's just dangerous. All right. So one of the other things that can happen, and this I think you know, we all kind of think of cysts and tumors as being fairly rare. This is something that does happen fairly frequently. I see it quite a bit. Definitely want to prevent this. We don't want to have this happen. This is what happens if you get a real bad one. I mean, this is a giant cyst inside the jaw. This does a lot of damage to jawbone. These can be recurrent. They can push the wisdom teeth into all sorts of crazy places. And needless to say, this is a big problem, and we've got to then reconstruct this patient. So crowding, another big problem, and for the folks in here that have had braces on, we don't want to move up orthodontic treatment that you already had by letting these teeth kind of push and shove everything around. If you didn't have braces, had nice straight teeth on your own, we don't want to see them get crowded up. Just kind of an image of what happens with crowding and wisdom teeth. Braces set everything back, and then these wisdom teeth come in after the braces are off. Push and shove everything around. It's not good. All right. Won't get any more good rates, sorry. All right, so some periodontal problems, gum problems. You get these big flaps of gum tissue, you get infections under here, but you know, there's a lot of missing bone in here. Excuse me. People already ask, you know, all the time, well, you know, why do I need to do this now? Can't I just wait till they bother me? Well, if you get periodontal disease in here and you lose bone in between these teeth, and now you're 30 or 40 years old, you don't have good support. You're not, when these wisdom teeth come out, you're not going to get any of this bone back. If you're a 15, 16, 17-year-old kid getting this done, then you'll actually regrow that bone and preserve your neighboring teeth. This is the one that everybody gets worried about. It's really kind of a scary concept, but you know, you get broken jaws from this. You know, you have a cyst like this in your jaw. That's one good piece of bread, one good, you know, chocolate chip cookie or something, and the next thing you know, you hear a big snap, and you can't figure out why your teeth don't fit together anymore. This, needless to say, is a big problem. Also, a lot of times you get broken jaws from trauma when you catch a pop in the jaw, and a lot of times the weakest point in the jaw is where the wisdom teeth are sitting, especially if they're impacted, and it is much more likely to fracture through that wisdom tooth. If you get your wisdom tooth out, this all fills in with good bone. Your jawbone is actually a lot stronger than it was prior to getting the wisdom tooth out. So we talked about all the reasons why. You know, there are a few reasons not to. Extremes of age. Obviously, if you're, you know, 78-year-old guy and you're, you know, not having any problems with it, we're not going to go in and chase after it. If you're medically compromised, too sick to either go to sleep or too sick to get this kind of surgery done. If it's going to risk damage to adjacent structures, anybody that's been through the consults, watch me, you know, draw pictures on the X-ray. Sinus cavity lives above, nerve lives down below these wisdom teeth, and you can get damage to those things, and they have to be repaired. Sometimes they can't be repaired because they're going to lip from getting your wisdom teeth out. That doesn't always come back. So if there's excessive risk of those things, then we're going to hold off on doing it. Sometimes if you're either missing a second molar or you need to have your second molar out, depending on the stage of development of the wisdom tooth, sometimes the wisdom tooth will fill in the space, and so you don't need to have your wisdom tooth out. It kind of acts like a second molar tooth. Kind of depends on how early that happens. You have to have some root formation left to go on the wisdom tooth for that to happen. If you have an uncontrolled active infection, if it's spreading and going to bad places, and if your jaw is so thin, from loss of bone, then removal of the teeth is likely to cause a fracture, obviously. In the mouth, 2018. Hell, it's getting 4 more. All right, so no more of this boring stuff. Now we're going to get to the good stuff. Third mold, right in, Guardians of the Galaxy stuff. All right. Okay, so signs of trouble. What's going to happen if we leave these in? What are you going to notice? What are you going to feel? When are these going to give you trouble? First of all, you're going to have pain. That's the one everybody kind of knows. Leave these things in, all of a sudden they start hurting. Difficulty chewing. The gum gets swollen, it gets red, it gets tender. You try to chew back there and it hurts. You get swelling of that gum, as I mentioned, soreness. Trismus is when the jaw won't open well. If you get infections, it gets the muscles that help you open and close your mouth get inflamed, get kind of spasm, it gets real tough to open your mouth, it gets real tight. You get swelling on that side, your whole face could swell up. And we're talking about if you leave them in, after you get them out, we'll talk about that a little bit. Fevers, and then you can get swollen, sore, tender lymph nodes too. There's all sorts of stuff on the internet, you can find that. All right, some of the other things, there's the painful opening of the mouth. Bad breath. Bad breath definitely happens from this. Ask anybody that's had an infected wisdom tooth. Pain in the lower jaw particularly, a lot of times is radiated to the ear. So you got ear pain, swollen gums, swollen glands, all the stuff we're talking about. So what happens when you come for a consultation, particularly when you come for a consultation in my office? That happens a lot. Because if you haven't noticed already, or if you haven't come to see me, I like to talk, so that sometimes happens. And then you're going to come see the guy with, the mad scientist look with the crazy hair. All right. So particularly in my office, what you're going to notice, and I have two wonderful people back there from my office. Jill's on the left and Karen is on the right. In my office, I looked for people that would take care of folks the way that I feel people should be taken care of, and hopefully, without a doubt, you're going to notice this. You walk in the office, greeted with a smile. A warm and caring staff, put you at ease. We know full well that everybody that comes to our office is scared to death. You don't have to say it. You can look as cool as you want. We know. It's a scary place to be. We know this is an anxiety-provoking experience. Nobody but nobody wants their wisdom teeth out. The only time you ever want your wisdom teeth out is when they're hurting you so bad you don't care if I rip them out without Novocaine. So, everybody is scared of having them done. Nobody wants pain, nobody wants swelling. It's always a scary thing. And we treat everybody knowing that, this is a scary place you're coming to, and we try to do everything in our power to kind of warm, soothing, comforting location. We call our waiting room the living room. If you've been in there, it's, there's couches instead of chairs, and coffee makers, and, water, and TVs, and everything. So we tried to make it, not so much for you guys, because you guys wind up coming right back and, and seeing me. But when you're having your wisdom teeth out and your parents have to be sitting there for, 45 minutes or an hour while you have your surgery, we want them to be comfortable, at least as comfortable as they can be. The other thing you're going to notice is we definitely have some cutting edge technology. All of these things are things that I use in my office. We have our own CAT scan. It's called a cone beam CAT scan. It's like a dental version of a CAT scan. It gives us nice three-dimensional images. We use this a lot for implants. We use it a lot for wisdom teeth. Gives us a lot of good views. When we talk about those complications in the consultation, we can get a lot more information from this and tell you a lot more reliably whether you're going to have problems or not than when you just have a regular dental x-ray from your dentist office. These two things down here, this is an actual picture of the laser that I use in my office. It's a soft tissue laser. This isn't used very much for wisdom teeth, but definitely if you need anything, biopsy or something removed, this makes it so much easier for you guys, and so much more comfortable afterwards. This guy is kind of a high-tech ultrasonic bone cutter. It sounds pretty awful, but the nice thing about this guy is it cuts bone but won't cut tissue, so if we are trying to get through some bone and don't want to damage the underlying thin soft tissue, we can avoid doing that. So besides the other reasons for the cutting-edge technology that we talked about, it gives us the most information possible to make sure that you have the best surgical experience we can give you. Having your wisdom teeth out, it's surgery. Especially when it's impactions, everybody thinks, oh, I'm going to go in and have a couple teeth taken out, no big deal. Anybody that's had 4 full bone impacts with wisdom teeth out, they know that's surgery. That's for real. It allows you guys, your parents, or anybody else, to understand the things that I'm talking about, the visual aids, and explaining these things is very important so that you know kind of what to expect. I use a lot of videos, a lot of patient education information. We have some of that stuff back there. I like to use the iPad and do a lot of stuff on YouTube and that sort of thing. We have a lot of models, hands-on stuff. It also makes your surgery much more predictable. Everybody wants to know exactly what they can expect after we're all done, and this way I can give them a pretty accurate prescription. And then, of course, minimizing complications is really important. There's a cool use of lasers. All right, so some of the other things, one of the things I pride myself on is, you're going to come in for a consultation, you're going to talk, we're going to talk to you about wisdom teeth, you're going to ask some questions, and you're going to get someone who actually will spend the time, which is why sometimes you have to wait in my waiting room. But you're going to get someone who spends the time, listens, can answer all your questions, really wants to make sure that you understand what we're doing, what the reasons why, and what to expect. I know when you go to a lot of other places, you're 3.5 minutes with the oral surgeon, the dentist, and the rest of the time with the staff, and usually our viewers are saying, see you later. We're going to spend more time. I want you to know with all that discussion that I'm knowledgeable, that experienced, and going to tell you exactly what you need to know and how to understand it, or to explain it in a way that you can understand it really easy. And then most of all, I spend a lot of time making sure that when you come back for your surgery, that you're as comfortable and as relaxed and as calm as you possibly can be. A lot of times you're still getting white in the face and ready to pass out. But, we want to make it as easy as we can, and the best way to do that is when you come for the consultation, that you have a pretty good understanding, you can tell that I know what I'm talking about, and that you can tell we care, and we're going to make it as easy on you as possible. So some of the questions people ask me all the time. Geez, am I going to snore? I don't know. Do you snore at home? If you snore at home, you're probably going to snore while you're sleeping with us. But we do have control over your airway. We're going to maintain your airway in a certain position. And a lot of times we can make that snoring stop. But yeah, you're going to snore sometimes, and we're kind of used to hearing it. No big deal. This is what everybody tells me. I don't know. I haven't had the tooth fairy come in a while, but everybody should love this one. That took me about 10 minutes to stop laughing when that happened. Of course, everybody wants to know, am I going to wake up? Well, that's a double-edged sword. Are you going to wake up when? Are you going to wake up during, or are you going to wake up after? Yes, you are going to wake up after. We like to talk about in our office that we have one rule, and only one rule. Everything else can fall apart and go, but if we put you to sleep, you must wake up. It's the rule. It's the law. It's the way it works. So yes, you are going to wake up, believe it or not. And of course, some people want to know, am I going to wake up during the surgery? You know, I get that question quite a bit, and the answer is no, you're not going to wake up, but should some crazy thing happen where you think you woke up, you don't have to worry. Some of the anesthetic nightmare stories that you've heard, having a breathing tube in and being paralyzed, not being able to move, not being able to talk. Yeah. Right, it's scary. It is a scary concept. That does happen on rare occasions in the OR, in the operating room. But this is why it won't happen to you in the office, anybody's office for that matter. You don't have a breathing tube, so you can speak. You're not paralyzed, you can move. So you're not just stuck there, being tortured. And the very first thing we do when we get you off to sleep is we numb everything. So even under some crazy situation where you gave us no warning signs and a little bit of time elapsed and all of a sudden you start to lighten up and with the rarest of circumstances regain consciousness, this is why you don't have to worry. So you're not going to wake up, because nobody really ever does, but if you were worried about that, this is why you don't need to worry. How long is it going to take me to recover? How long am I going to be laid up from the surgery? You talk to some people, you're going to get a lot of different answers. You're going to get a lot of different responses. There's a reason. It's not a cop-out answer. It does depend. When folks come in and they say, well, I don't know, I talked to this guy and he said, that night he was out and he was, riding his BMX or whatever, there's reasons why the recoveries are so different. Usually it has nothing to do with you guys. It doesn't have to do with how tough you are, how much of a, poor patient you are, a baby or anything like that. It has to do with a lot of times this, what kind of wisdom teeth are we dealing with? If they're fully erupted, if they're in your mouth where we can see them, that's like a regular tooth extraction. That's a day or two. So those are the folks that are saying, I don't know what all the hype is. Had them out and a day later I was fine. The fully impacted wisdom teeth, that's the week of misery that you always hear about. That's the week of pain medicine, week of giant chipmunk cheeks. You feel like you've been hit by a truck and you're laying in bed for pretty close to a week. Sound familiar? Yeah. Believe me, I wish nobody had these because I would have a better reputation. And then the partially impacted ones, those are somewhere in the middle, and it kind of depends on how much work I have to do to get them out, but in general, that's somewhere in between, about 3 to 4 days or so. Even the animals getting involved, they're trying to steal my job. So what to expect on the day of surgery? What's going to happen when you come in the office terrified and about to have surgery? Here's how we do it, right? Very high tech. Very high. Woo! It's over, now what? Right on time. So here's what you should expect. Are you going to be nervous? Sure. You're having surgery. There's not a single person in the world that's having surgery that isn't nervous. So you're nervous, okay, that's all right. It's all right. We're going to hook you up to a bunch of monitors. It looks kind of scary sometimes. But what you need to know about all those monitors is that's how we're making sure that you're okay. So yeah, you're going to hook you up to monitors, but we're going to make sure you're doing okay. Are you going to fall asleep? Of course you're going to fall asleep. I've had about 4 or 5 people tell me that they're going to fight it. They're not going to sleep. No matter what I do, they're not going to sleep. Nobody beats the anesthesia. You will fall asleep. And yes, you will wake up, like we talked about. The beautiful thing is when you wake up, it's done. The teeth are gone. And you're going to turn around and ask Jill back there, one of our clinical assistants, or me, all right, when are we starting? What do you mean my teeth are out? What? Yeah, no, it's done. Yeah, oh, okay, really? And then we're gonna move you into our recovery rooms, which are like little closets. It's a little tiny closet. It's the thing that irks me the most about my office, but that's all right. You'll have no idea how you got there. Everybody gets recovery. They ask the same thing. How the heck did I get here? I don't even remember. I woke up in here? No. I threw you over my shoulder and I carried you. No. You're going to repeat yourself. And then again. And again and again and again. And you're going to drive your parents crazy. And then more than likely you're going to do this.
I did that.
Right? Everybody wants to do this. We always say, okay, on the way home, I can't control what you do in the car, but while you're in the office, nobody can do this. But you're not going to remember doing it. This is the post-operative experience, all right? So this is pretty cool. You can break out your iPhone and set alarms, and I recommend doing this. It's kind of a good thing. Keep track of when you're supposed to take what medicines, because you're going to have a bunch of them, and you're going to look something like this. All right, so what do you need to do? What do you need to know? Post-operative experience. You're going to rest and more rest. And then after that, you're going to rest some more. Like we talked about, the recovery time depends on how these teeth were positioned. And then we're going to give you some narcotic pain medicine. This doesn't respond really well to over-the-counter. I kind of wish it did, but it doesn't. So we're going to give you some good old pain medicine. You're going to have swelling, you're going to have jaw tightness, and you're going to have numbness at least for the first day. At some point, you're going to wonder when your face is ever going to come back. But your pain can be managed very effectively. People like the pain meds. Love this kid.
Oh my goodness.
This is what you're going to look like. These are the chipmunk cheeks. You're going to look like a basketball. And then this happens. This.
That made me happy, very, very happy. This video makes me happy. Take a look at this.
This is the video you guys will make. What's this thing in the room?
It's a fun thing to watch, isn't it? Yeah. You are a rock star, Maddie.
You never know. You're right on the Ellen Show.
Maddie, had I realized you wanted me to come watch you get your wisdom teeth taken out, I would have been there. I would have been on the first plane to Montana. But I'm so sorry that you wanted me to watch you get your wisdom teeth taken out.
Shoot, we should have figured that out.
Yeah, you should have called. So